The last principle of occupational hygiene is control, which means controlling hazards or stresses at the workplace by implementing appropriate control measures in order to minimize the exposure. Controls are usually placed at the source, where the hazard comes from, along the path where the hazard travels, and at the receiver, which are the workers, those who are exposed to the hazard. At source, control measures such as eliminate or remove the hazard or substitute the hazard with the less hazardous substance or put enclosure or engineering control. Along the path, control measures include increased distance between the source and the workers and use of barrier, while controls at the receiver include performing good work practice, inculcate safety awareness towards good attitude among the workers, and wearing appropriate personal protective equipment. Let us elaborate more on the control measures. Engineering control is a method that is built into the design of a plant, equipment, or process to minimize the hazard. For example, installations of general ventilation, localized ventilation, and use of water spray. General or dilution ventilation is used to supply large amount of fresh air into an area or building. This type of ventilation system dilutes the contaminants by mixing the contaminated air with clean air. Thus, the concentration of contaminants can reduce to the acceptable exposure levels. It usually involves mechanical ventilation using large exhaust fans placed in the wall or roof of a room or building. However, it does not completely remove contaminants and cannot be used for contaminants containing highly toxic chemicals. Local exhaust ventilation, or LEV, which involves removing the contaminants by trapping them at or near the source, is also versatile and can be a more effective long-term control measure than general room or dilution ventilation. LEV is generally a far more effective way of controlling highly toxic contaminants before they reach the workers' breathing zones. This type of ventilation system is usually the preferred control method if any contaminants pose serious health risk and large amounts of particles, gases, and vapors are generated. The LEV system has 6 basic components: a hood or opening that captures the contaminants at the source, duct that transport the airborne contaminants through the system, an air cleaning technology that removes the contaminant from the moving air in the system, fans that move the air through the system, an exhaust stack which the contaminated air is discharged, and makeup air that replaces the exhaust air. Safe work practices include companies' general workplace rules and other operation-specific rules. Through established safe work practices, employee exposure to hazards can be further reduced. Safe work system and practices can be considered forms of administrative controls aimed at reducing employee exposure to hazards. These measures include additional relief workers, exercise breaks, and rotation of workers. These types of controls are normally used in conjunction with other controls that more directly prevent or controls exposure to the hazards. Personal protective equipment, or PPE, is additional clothing or equipment which is intended to be worn or held by a person at work in order to protect them against one or more risks to their health and safety, and any accessory designed to meet that objective. PPE is not the first choice, but may be an appropriate form of control where other choices are not practicable or in combination with other measures, where the nature of the hazard requires a layered level of protection. There are several types of PPE can be used to protect the workers from injury or infection. Safety helmet to protect head, goggles, safety glasses and face shield to protect eyes and face, earmuffs and ear plugs to protect hearing, face mask, respirator to protect respiratory system, safety harness, apron and heat-resistant clothing to protect body, gloves to protect hand, safety shoes and Wellington boots to protect leg and feet. We have finished discussing the principles of occupational hygiene. Now, who is responsible to apply all the principles of occupational hygiene professionally at the workplace? Yes, industrial hygienist. Occupational or industrial hygienist is a competent, qualified, and certified person having a degree in engineering, chemistry, physics, medicine, or a related biological science. He or she also received special trainings in three major areas. First, recognition of the interrelation of environment and industry. Second, evaluation of the impairment of health and well-being by work and the work process. And third, the designation of recommendations for mitigation of such problems. Occupational or industrial hygienist may be involved with the assessment and control of hazards in the workplace or community that could cause injury or disease. Thus, he or she is necessary to familiarize with a set of skills and knowledge, as mentioned earlier, such as interactive communication, technical writing, creativity, curiosity, judgment, common sense, engineering, biology, chemistry, mathematics, physics, and medicine. We can conclude that anticipation, recognition, evaluation, and control of hazards are vital principles of occupational hygiene. An occupational hygienist required a set of skills and knowledge for measuring and controlling the rising hazards at the workplace using those principles. Well, are you interested to be an occupational or industrial hygienist? If so, prepare yourself to be certified from now. Good luck! Thank you.